Treatment of hemorrhoids. Medication classification. Mechanism of action. Exemplars, examples, topical anesthetics. Provide temporary relief from burning, itching, and pain. Benzocaine, Dibucaine, Lidocaine. Protectants, emollients. Form a physical barrier on the skin to prevent irritation of the perianal region. Cocoa butter, lanolin, white petrolatum, zinc oxide, mineral oil, cod liver oil, or shark liver oil. Astringents. Promote skin dryness, which helps relieve itching, irritation, and inflammation. Calamine, zinc oxide, witch hazel. Corticosteroids. Reduce inflammation. Hydrocortisone cream. Medications used in the treatment of inflammatory bowel disease, IBD. Medication classification. Mechanism of action. Exemplars, examples, aminosalicylates, anti-inflammatories. Block production of prostaglandins and leukotrienes to decrease inflammation. Sulfasalazine, azulfidine, mesalamine, 5-ASA, acicol, pentasa, roasa, canasa, olsalazine, dipentum, balsalazide, calazole, antimicrobials, anti-infectives. Used to control clinical manifestations in Crohn's disease but not effective in ulcerative colitis. They are used to treat secondary infections. Metronidazole, Flagyl, ciprofloxacin, Cipro, corticosteroids. Decrease inflammation but should be given for short periods of time during exacerbations and tapered appropriately because of long-term side effects. Dexamethasone, Decadron, budesonide, Entocort, biological therapies. Alter a person's immune response. They alter an inflammatory protein called tumor necrosis factor, TNF. Infliximab, Remicade, certolizumab, Cimzia, adalimumab, Humira, natalizumab, Tysabri, immunosuppressives, antagonists. Modify the activity of the immune system to decrease inflammation. May be used for long-term therapy. Azathioprine, Imuran, mercaptopurine, pyrenthal, cyclosporin, Sandomune, Neoral, sirolimus, Rapamune, Ontal L12/23. Used for treating patients who are native to biologics or who have failed standard therapies. Ustekinumab, Stelara, humanized anti-alpha-4 beta-7 integrin monoclonal antibody, gastrointestinal anti-inflammatory. Prevents excess WBCs from entering the GI tract, controlling inflammation. Vedolizumab, Entyvio, antidiarrheals. Provides symptomatic relief and bowel rest. These medications must be used with caution because they can cause colon dilation. Diphenoxylate and atropine, Lomotil, loperamide, Imodium, medications used in the treatment of irritable bowel syndrome, IBS, medication classification. Mechanism of action. Exemplars, examples, anticholinergics, antispasmodic agents. Anticholinergic and anti-muscle spasm components that block acetylcholine, relaxing smooth muscle spasm and GI motility, and inhibit gastric secretion. Dicyclamine, Bentyl, Antispaz, hyoscyamine, Aspaz, Anaspaz, antidiarrheals for IBS-D. Slow bowel transit, enhance water absorption, and strengthen anal sphincter tone, resulting in fewer stools but does not relieve pain. Loperamide, Imodium, antidiarrheals. Decrease motility, propulsion, and secretions. Diphenoxylate hydrochloride, Lomotil, mu-opioid receptor agonist. Combines a mu-opioid receptor agonist and delta-opioid receptor agonist that interact to decrease GI tract secretions. Alexidaline, Viberzi, guanylate cyclase agonists. Stimulate intestinal fluid secretion and transit for IBS-C, despite treatment with osmotic laxatives. Linaclotide, Linzess, Plecanatide, Trulance, serotonergic, 5-TEXT-HT_3, agents. Agonist activity causes release of other neurotransmitters and results in increased peristalsis, increased intestinal secretion, and decreased visceral sensitivity. Tegaserode, Zelnorm, for IBS-C in female patients. Sodium, hydrogen exchanger 3, TEXT, NHE_3, inhibitor. Reduces absorption of sodium and phosphorus, Rytero enhances intestinal fluid volume and transit. Tenapanor, Ibsrela, selective 5-TEXT-HT_3 receptor antagonists. Limit gastrocolic reflexes, which can slow transit time and improve muscle tone. Alozitron, Lotranex, for refractory IBS-D in female patients. Selective type 2 chloride channel, TEXT, CIC2, activator. Increases fluid secretion in the small intestine and is believed to enhance colonic motility by increasing intraluminal volume. Lubiprostone, Amitiza, for IBS-C in female patients. Selective serotonin reuptake inhibitors, SSRIs. SSRIs inhibit serotonin uptake and may increase pain threshold, while serotonin reuptake inhibitors, SSRIs, such as paroxetine, Paxil, fluoxetine, Prozac, and sertraline, Zoloft, may increase pain threshold while decreasing transit time. Tricyclic antidepressants, TCAs. TCAs block norepinephrine reuptake and are believed to slow transit time and improve pain tolerance. Amitriptyline, Elavil, imipramine, Tofranol, nortriptyline, Pamelor, dazipramine, norpramine, medications used in chemotherapy treatment of colorectal cancer. Medication classification. Mechanism of action. Exemplars, examples, antineoplastic, antimetabolite, cell cycle specific, interfering with the synthesis of DNA and RNA, causing their death. 5-fluorouracil, 5-FU, with leucovorin, LV, antimetabolite antineoplastic. Converted in tissue to 5-FU, which inhibits DNA and RNA synthesis by preventing thymidine production, causing death of rapidly replicating cells. Capecitabine, Xeloda, antineoplastic agent. A platinum-based antineoplastic agent, binds to DNA and RNA, miscoding information and/or inhibiting DNA replication, and cells die. Oxaliplatin, aloxatin, antineoplastic, angiogenesis inhibitor, recombinant monoclonal antibody. An anti-angiogenesis medication that reduces blood flow to the tumor cells, depriving them of nutrients needed for replication. Bevacizumab, Avastin, antineoplastic. Inhibits the enzyme topoisomerase I, required for DNA replication, causing cell death by damaging DNA produced during the S phase of cell synthesis. Irinotecan, Comptosar, antineoplastic, recombinant monoclonal antibody. A monoclonal antibody that binds to protein to slow cell growth. Cetuximab, Erbitux,